Today, we're diving into one of the darkest chapters in medical history, the UK's contaminated blood scandal. This tragedy affected thousands of lives and continues to resonate today. Let's uncover the details and understand the impact of this devastating scandal. During the 1970s and 1980s, thousands of people with the blood-clotting disorder haemophilia were given blood that was contaminated with HIV and hepatitis. This affected not only haemophiliacs, but also individuals who needed blood transfusions after childbirth or surgery.
I had a postpartum hemorrhage. I was rushed into hospital.
I was so traumatised. Once they tell you you've got Hep C, you want to know what stage you're at. I felt like I was dying, and that the next day I could have...
Today, we'll explore how this happened, the consequences, and the ongoing fight for justice. In the early 1970s, the NHS introduced a new treatment for haemophilia called Factor A8. This product was created by pooling plasma from many donors and was seen as a wonder drug for patients with classical haemophilia and von Willebrand syndrome. However, the nature of Factor A8 was such that even one infected donor could compromise the entire batch. The NHS imported Factor A8 from the United States, where plasma often came from high-risk donors, including prisoners and intravenous drug users. The inquiry estimates that more than 30,000 people were infected with HIV or hepatitis C, including 250 haemophiliacs who contracted both. Many of these individuals later died from AIDS-related illnesses, and an unknown number passed HIV to their partners. The Guardian reported that most hepatitis C infections were seen in transfusion recipients, and as many as 380 children were infected with HIV. Nearly two-thirds of those infected with HIV later died of AIDS-related illnesses. Reports have revealed that school children, some as young as 2 years old, were subjected to medical trials using infected blood products without proper consent. Documents show that doctors knew the blood products were likely contaminated, but used them anyway to enroll patients in clinical trials. Of the 122 pupils who attended Traylors College between 1974 and 1987, 75 have died from HIV and hepatitis C infections. The British government knew about these trials and even covered some costs. It wasn't until 1985 that all Factor VIII products were heat-treated to kill the HIV virus. UK blood donations were not routinely screened for hepatitis C until 1991. Despite numerous warnings from the World Health Organization and other bodies, the British government largely ignored the risks due to financial concerns. Victims and their families have been fighting for justice for decades. In 2017, then Prime Minister Theresa May established the Infected Blood Inquiry, chaired by Sir Brian Langstaff.
Sobering thought that the consequences of what happened then may be continuing to cause death even now. Many inquiries are about events which have happened where it is known exactly how many people may have died. Few, if any, this may be the first, are where deaths are continuing.
The inquiry heard evidence from those affected and is expected to call out pharmaceutical firms, medical practitioners, and government officials. The contaminated blood scandal is a tragic reminder of the importance of safety and ethics in medical practice. As we await the final report from the inquiry, let's remember the victims and continue to support those affected by this injustice. If you found this video informative, please like, comment, and subscribe to our channel for more in-depth stories and updates on important issues.